Or are you waiting until you've done?
Yeah, we'll do that. I'm just going to wait for after that's fine. Yeah. First of all, let's get the recording going, and then I'll ask Marlo just to launch the quick opening poll, which is hopefully will help us just capture a little bit of information. You'll need to scroll down. There are 3 questions, but you'll need to scroll down to see each of the questions. So if we'll take a minute or so to capture that information. Another 30 seconds or so, I can still see people commenting or inputting their views. Okay. A couple more seconds, I can still see those numbers going up. Okay, that's great. Thank you, Marlo. I think we'll close that poll now. That's really helpful. Thank you very much. We'll be using that information to help us to understand who's here today and any difference that this session today makes for people's understanding and knowledge around this topic. And we'll repeat that poll at the end of the session. Okay, so I will now hand over to Carol Kuchera from NHS England, who's been working with us on this project and is going to talk through the wider picture of digital health services and in relation to health inequalities. So Carol, over to you.
Thank you, Jo. Thank you very much. And good afternoon, everyone. Thank you for joining us here today. It's a real pleasure to be here as we're here to launch the new co-designed resource, which is focused on belief and trust barriers in digital health. There's 3 things about it, I think. That first of all, it's practical, it's informed by the community, and it's grounded in real life experiences. My name is Carol Kuchera. I'm a Senior Healthcare Policy Manager in the National Healthcare Inequalities Improvement Programme, and NHS England sponsored this work through the Health and Wellbeing Alliance because we know that when it comes to digital inclusion, trust, confidence, and communication matter just as much as connectivity and digital skills. But this work also kind of supports much broader aim, which is to make sure that digital transformation improves access, experience, and outcomes for everyone, not just those who are already quite well connected. And as I'm sure you are very well aware, we're seeing a very rapid shift in how people access health services. Digital tools from online booking to the NHS app have become now well-embedded parts of everyday healthcare. So in fact, back in May 2024, over half of UK adults who are already online visited NHS digital services. And while we can see very clearly that the usage is growing, not everyone feels connected or confident or safe using these tools. Actually, could we take the slide down, if you don't mind? That would be great. And then we will come back to the second one. So just a few stats around this I wanted to say. So we know that around 6% of UK adults still don't have internet at home. 1 in 5 also lack the digital skills that are needed for everyday life. And we also know that age, disability, language, and trust, they all shape people's ability to engage with digital health services. So if we don't design with those realities in mind, we are very much risking deepening those inequalities, not reducing them. And so that's why the NHS England and Healthcare Inequalities Improvement Programme supported this project, because Good Things Foundation, working with community partners, led a really strong co-design process with people who face digital barriers every single day. And the outcome of this, I think, is simple, but it's very, very powerful. So we now have a report and a leaflet which are designed to open up those really, really important conversations. And it's important to say that this is not about pushing digital. It's just about creating space for people to ask questions, to raise their concerns, and to make them feel like they really have choices, because we all do. And it's also one step toward the kind of multi-channel inclusive system that we want to build for the future, and one that really meets people where they are. And that's I think, super, super important. Could we have the slide back up, please? The second one now. So I'll just give a very brief overview of where we are in terms of the program. So as the National Healthcare Inequalities Improvement Programme in NHS England, we have 5 strategic priorities. And priority 2 is about delivering action on digital inclusion. So back in September 2023, we published the Digital Inclusion Framework, and this resource by Good Things Foundation and the ecosystem of theirs directly supports this, because the beliefs and trust are one of the 5 key priority areas of the framework. And if you haven't seen it already, I would strongly encourage you to read through it. I've put the link on the slide, so it will be available for you. So the resource, as well as the framework, are aligned also with the Laura Wade-Gery review, which made it very clear that digital transformation must reduce and not widen healthcare inequalities. And it's also part of our joint effort with the Department of Science, Innovation and Technologies, Digital Inclusion Action Plan to improve access, to improve confidence, and to do design in an inclusive way. We all know that healthcare needs bold innovation, but it won't work unless we design it together. And digital inclusion is a very, very complex challenge. So the barriers people face range from cost and poor connectivity to inaccessible design and lack of trust. And tackling them needs a practical, joined-up approach that meets people where they are, and I firmly believe that no one should be left behind in the digital world. So let's keep building digital confidence, one human connection at a time. Now, what we've learned from this. So Joe and colleagues will talk about this in detail. I don't want to steal the thunder, but I just wanted to say that the stories from this project are very, very clear. So people want to understand how the data is used. They want to feel heard, and they worry about being misunderstood or having no choice but to go to digital. And these are really not marginal concerns. They all reflect real life experiences. And it's not about digital resistance. It's about wanting services that are trustworthy, that are usable, and that are human. The leaflet, as you know, is now available. Joe and colleagues will talk about it a bit more. But we want it to be used, right? We don't want it to be just sitting somewhere and gathering dust. So we want it to be used in GP practices, in community spaces, in outreach work, in peer support groups, and we strongly, strongly encourage you to share it, use it, adapt it, and let us know how it goes. Before I finish and hand over to Joe, I just wanted to reiterate that digital transformation offers real opportunities to improve access to personalized care and to strengthen the outcomes. But none of that will work if we leave people behind. So whether you work in policy, in a general practice, in a local authority, or in a community group, I invite you to start a new conversation this week. Ask someone, or indeed yourself, how they or how you feel about using digital health services. And then really listen and use what you hear to shape what you do next. Because inclusion doesn't just come from new tools. It comes from how we use them together. So thank you very much. I'll hand over to Joe.
Thank you so much, Carol. That's great and really motivating. And just to say a great appreciation from our side for the support and input that from you and from your colleagues in your team as well for this. It feels like it's been a genuine partnership piece of work where we hope that the learning that we've got from this report will and this piece of work will go back in and be heard in the health care system and policy space. So that's really exciting. Thank you for that.
Thank you.
Just a reminder, and for those of you who joined a few minutes into the session, if you've got any questions or reflections or comments, please feel free to put them into the chat. I can see things are starting to come in already, which is great. And what I'll do now is move on to kind of looking at the detail of what we did and what we've learned through this project, looking at belief and trust barriers. And I'll talk through in more detail some of the things that Carol's already mentioned in terms of the report and the leaflet and the kind of key output from this piece of work that we want you to understand and hopefully take up. So as Carol mentioned, the NHS Framework for Action on Digital Inclusion is a really key piece of work in the past couple of years to help us to identify where action needs to be taken to make sure that digital health services are inclusive and accessible for all. And there are 5 key domains. I think Marlo might pop the link to the framework into the chat now, if you don't mind. Thank you. And beliefs and trust are one of those core domains in the framework. But there's also acknowledgement that actually maybe we don't understand enough about what those belief and trust barriers might be. What is it that makes somebody feel confident enough, assuming that they have access and skills in relation to digital, but what is it that helps somebody to feel safe and confident enough to engage regularly with digital health services? And how can we help people to get to that point? So taking this framework and this focus on beliefs and trust, we devised a project to explore what these barriers are, to help us to really understand in more depth what they are, and then to work with people who have experience of facing challenges with engaging with digital health services or other online services, to help us to work with them to design a simple resource that can start to help address some of these belief and trust barriers that we identified. Just to give a little bit of context, what we mean or what we use as our kind of framing of digital health services for this project, given that this could cover a very wide range of things, we focused it particularly on things like the NHS App, GP appointment booking platforms, the video platforms that people might be asked to use for consultations or for receiving therapy or treatment, a range of different kinds of apps that people might be asked to use for monitoring their condition or for receiving treatments, and any other kind of online platforms or tools that people might use to access information about their personal medical care or conditions or accessing other services. So it's quite a broad range of potential services, and we entered into this project with the idea that we were primarily looking at the primary care context, because that's where most people will first encounter or first be asked to use digital health services, for example, the NHS App or GP appointment booking platforms. But we kept it open a little bit, so we didn't discount people's experiences that went beyond primary care, but that's where we started from. Just a quick overview of what we did and how we did it. So we did some background research. There is a lot of useful, relevant, recent literature from academic circles, from policy, from other voluntary community sector organisations who've been looking at this. So we had a look at that and brought some of those insights together. And then using that insight, we designed our co-design process. So this was taking a design approach to working with people who have lived experience of engaging and struggling to engage with online tools, with online services and digital health services. So we worked with 3 community organisations to help us to recruit and to host these first round workshops. And in those workshops, we explored with people their personal experiences of using digital health services, their perceptions, their beliefs and their concerns about these health services, and to really get under the skin of what what those belief and trust barriers might look like, and to also to prioritise those. We also heard in those first round workshops some really positive experiences of people who have been able to engage with digital health services and have found them beneficial, found them much more convenient, or have kind of felt empowered by being able to engage with them. So it wasn't all negative, but we were looking to prioritise those barriers as well. We then had a second round of workshops with our co-design participants to kind of hone in more on what kind of resource might be useful to help address these belief and trust barriers that we'd identified with them in the first round, and to kind of start that design process. We then brought in another layer of consultation with a wider group of people, including health and care professionals and other community members, to kind of sense check some of the things that we'd been hearing through the workshops, and to help us refine and narrow down some of the ideas so that we could prioritise what we were going to do. And then we had a final round of finalising the design of the leaflets, and that involved getting further feedback from those original co-design participants to make sure that that the final design made sense to them and echoed their inputs and the concerns that they'd identified at the beginning of the process. So Carol's kind of alluded briefly to the areas of concern, but there were 4 key areas of concern, 4 key belief and trust barriers that came out of the workshops and also are reflected in some of that existing research as well. So I'll talk through these briefly now, because they form the main structure of the leaflet that I'll go on to talk about. So a key concern was about data sharing and privacy. This probably won't come as any surprise, but lots of people had concerns about who had access, who could see the information that they might be asked to input into a digital health service, whether in the NHS app or on a booking platform or things like that. People worried about what happens if there is a data breach, loss of data, and there are high-profile examples of medical data being breached and systems data being compromised. And then for some people, a fear that their data, personal medical data, might be shared with other external parties beyond the health system, and for whom they might not have the patient's best interests at heart. And I think there's a sense that people who already face additional challenges or feel more marginalised in relation to health services might fear that more strongly. So this is a quotation from one of the workshops that were held with the co-design participants: this fear of who not understanding who can see data and personal medical information. A second key concern was that this perception that it is harder to communicate with health professionals through digital tools, whether video consultation or through writing about your condition in a booking platform, and therefore the quality of care might be compromised. People felt that they might struggle to be heard, to really be able to articulate their concerns if sort of non-verbal cues are less evident to the care professional. And that you might not be able to pick up on the more contextual information that a health professional might need to make a kind of full assessment, and this sense that it would feel less personal to the patient as well. And for some people, they identified additional language and literacy barriers. For example, if being asked to write about their condition and their need for an appointment on a GP appointment booking platform, and felt that they might be at an additional risk of not being heard, not being seen properly, and their concerns not being taken seriously, and therefore they may not get the appropriate care as a result. And there's a common perception that digital health services may be difficult to use, hard to get started, takes time and effort, and particularly for people who are already facing personal health conditions that take up time and energy, and or are caring for others. It seemed like another thing on the list of and just perhaps too much for somebody to get to grips with. And there's a sense that people didn't know where they could go for support if they are struggling to engage with the system or a service, or if they think, have I done something wrong? Is it that the system, the digital service isn't working, not knowing where to turn next? and a sense that there is a higher risk of making a mistake using a digital health service, both in terms of patients inputting their own information or staff engaging and using digital health services. And therefore that might lead to a lack of appropriate care or a delay in care. And then finally, as Carol sort of mentioned earlier as well, this sense of choice and autonomy came through really strongly in the workshops as well. People feeling that the shift to digital health services is something that's been taken out of their hands. They have no choice over how and when to engage with digital services, and that they're not designed for people like me. And a sense that if you say yes to engaging with the digital health service at one point, and then that might mean that the door is closed on you to having face-to-face or more traditional health service delivery in the future. And so the sense of trying to resist that by not engaging because of fear of not being able to go back to traditional delivery of health services. And then, as I said, through the co-design process, we engage the participants to help us to understand what a useful resource might look like, what might that be, and we got some really, really useful feedback in terms of what the resource should feature and how it should look and feel. So the co-design participants highlighted that they felt it should reassure people that their belief and trust concerns are valid and are shared by others. It should have a balanced tone. It shouldn't be seen to be selling digital health services, but be able to kind of show the challenges and the benefits of digital health services, and that it should be used in conversation. It shouldn't be something that's just given to somebody and then they're sent away and expected to digest the information and get on with it themselves, but actually it should be used in dialogue so that people feel able to ask questions, and that they can then be signposted to the next sort of level of support that might be needed. And people also wanted to see case studies of positive experience to understand what that journey might be to somebody engaging with digital health services and having a positive experience of it. And then we had a range of practical considerations as well in relation to making sure it's something that could be easily printed, that's something that had enough information but not too much, and then things around making sure the information is doesn't go out of date too quickly, and lots of things like that. And then we also, through this piece of work, there were broader insights that we gained from the co-design process. It wasn't just focusing on the leaflet, but these broader recommendations and learning that we think are relevant for the wider health and care system in relation to digital. One of these was that staff also may face belief and confidence barriers around engaging with digital health services, so need support and training to be able to use them confidently themselves, and then to be able to support patients to use them as well. I'm sure everybody will be able to identify with this one, but the idea that there are so many different digital health tools, apps, platforms, services out there, it's a really confusing range. And if you're someone who is not particularly confident about engaging with them, if you're asked to switch to a different platform or look at something new, that could be really off-putting. So there's a need to reduce this variety and have more consistency to make it easier for people to engage and to feel confident doing so. And we also need a clearer communication across the health system about why this digital shift is happening. And I think this could be really important for this trust gap. So when people are feeling that they've been shut out of the decision making, they see it only as a cost-saving exercise, but actually being clearer about how digital health services can actually make access to care better for a lot of people, and whilst still leaving open more traditional routes for accessing care for those people who really need it. So a better communication about that, but also acknowledging that actually some of these tools, they're not perfect, and there are clunky issues with a lot of these systems. So a bit more of transparency in the communication about the shift to digital will be beneficial. And something that has been said lots of times in relation to digital health services, but also other online services, but they really need to be inclusive and accessible in the design, to make sure that the people who might face the most barriers are at the heart of the design of new digital health services, and also that we need well-resourced local support to help people to get to grips with them. And that's something hopefully that Bernie will be able to talk to shortly from the perspective of forward carers. So I think Marlo will pop the link to the project report in the chat if they haven't done so already. And then I'll just, in the last couple of minutes, I'll just draw your attention to the leaflet. So this is the main output from this piece of work, the thing that we're really proud of, and we're so grateful for the input from our co-design participants. This leaflet, I think Marlo will pop the link into the chat as well for the leaflets. You'll see that there's several different versions. It's been designed to be easily printed in colour or in black and white so that it can be folded into an A5 sized leaflet. Or there's versions that are easier to view online or that can be printed off as single A4 sheets. So we've taken that into consideration, and we have designed it, as we said before, to be used in conversation. So we're imagining that it can be used in community settings. If somebody comes in and says, I've been asked to download the NHS app, I'm really not sure about it, I've got a lot of concerns, that this leaflet can be used as a way to navigate and explore what those specific concerns are, and to help people to identify questions that they can ask of in that community setting or of their healthcare providers, to help them feel more at ease and to feel more confident to decide when and if digital health services are right for them. So as Carol said, we'd love for you to engage with this leaflet, have a look at it, download it, use it, community settings and healthcare settings, and see, hopefully use it as a way of starting that conversation and helping people to feel more reassured about their concerns, but also more confident to make a decision that's right for them and to ask questions to help them get the information that they need. And then finally, our next steps are, we'd love to create more additional versions of this. At the moment, it's only available in this hopefully fairly simple language, but we do know we need to make some additional more accessible formats. We'd love to hear your feedback when you use it and what's going well. Maybe if there are challenges, suggestions for improvement, would be really open to that. And also, we know that these concerns are not only seen in relation to digital health services. So we're really keen to explore where there might be crossovers with other areas, for example, online banking and things like that. And just to acknowledge the people who participated in the co-design process, really, really valuable inputs that really have made the leaflet what it is. The three community organisations who helped facilitate and host those workshops, and the people who contributed to the additional consultation activities, our colleague Sarah Alden, who facilitated the workshops, and NHS England and the Health and Wellbeing Alliance for the support with this project. Okay, I think that's me done. So I'm going to now pass over to Bernie from Forward Carers, and also to Shaf. Bernie, shall I stop sharing? You don't have any slides, do you?
I don't know.
No,
I'm
okay,
just gonna.
That's fine.
Yeah.
Lovely.
Yeah.
Okay, I'll pass over to you. Go ahead.
Okay, yeah. So I'm Bernie Huntingdon. I'm carer engagement project manager here at Forward Carers. And Forward Carers, I just thought I'd tell you a little bit about us as an organisation. We're an award-winning not-for-profit organisation, and we've been supporting unpaid family and friends carers since 2014. Our mission is to create carer-friendly communities across England, and by that we mean communities and places that understand, value and support unpaid carers so that they can thrive at school, because we've got young carers, at work and in all areas of life. So what is a carer? A carer, you don't need to be in receipt of state benefits to qualify as a carer or to be eligible for our support. A carer can be a family member, neighbour, friend, or anyone really who provides support to someone who has a disability, serious illness, frailty or addiction. And support can be things like if you're doing tasks like personal care, help with medical appointments and medication, shopping and housework, emotional support or even financial support. We're commissioned by local councils and NHS trusts to deliver services in Birmingham, Walsall, Dudley, Dorset and Wiltshire, and we provide specific support to unpaid carers. So to ensure that our services address carers' needs, we run a programme called Carers Voice, something that I actually lead on. Our Carers Voice engagement programme provides an opportunity for carers to have their say on various topics, to share their views and experiences so we can shape and design our services. And this can also share their own personal story of being a carer to inspire others. So last year we were approached by the Good Things Foundation to help with their project around barriers to accessing digital health services as part of their partnership with the Health and Wellbeing Alliance. Carers were identified as a group who might find difficulties with accessing digital health services, things that we've already heard about like the NHS App, online appointments and healthcare apps. So we were selected and invited to help with this research. So this topic was of particular interest to us. I'd actually recently held a carers focus group in Walsall on behalf of the Black Country Integrated Care Board to explore carers' experiences of primary care, especially around GP appointments. So I was really interested to know how carers felt about accessing health services digitally, and the opportunity also aligns to our Carers Voice engagement programme and our ongoing work to tackle digital inclusion. I also really appreciated that the Good Things Foundation provided vouchers as a thank you to carers, and that to me was a clear sign that their lived experience, expertise and their time is valued and respected. And where we can, we try and co-design and ideally co-produce services for carers. So this research was a big win for us. We got carers' feedback would be used to co-design a resource to help others overcome fears around digital platforms to access healthcare. So we were really excited about it. So we promoted the research, and then last November we hosted 2 small focus groups to explore the experiences of carers and around to really dig deep into their beliefs and trust around these issues about digital health services. We had 12 carers attend both focus groups, so they were given short scenarios to read and comment on. The scenarios were really good actually because it gave different examples and case studies of requests where somebody was asked to download the NHS app, book a GP online rather than via the phone, using an app to monitor diabetes and having a GP consultation via video. So obviously this actually gave a really good platform for carers to get stuck in and get their ideas flowing. So you wouldn't be surprised to hear that issues around lack of digital confidence, scams, data security and reliability of internet connection were just some of the concerns that were listed. And carers' feedback was then used to shape the next workshop, and that was to actually co-design the tools to help address their main concerns, and that actually turned into the leaflet that we've just seen from Jo. And carers were really positive about participating in the focus groups. One carer said she enjoyed hearing about carer experiences and opinions, clarifying how she feels about digital services. Some carers said the workshops encouraged them to participate in digital healthcare tools in the future, while others said that the information shared with the group will help them with their caring role. So there's been many benefits to hosting these focus groups. Some participants downloaded the NHS app because of being part of this research, while others shared how they used Teams so that they could actually be present at a family medical appointments. So that really helped them with their caring role. This particular carer was in Birmingham, and her person that she cares for was down in Devon. So it really helped that she was able to be present for that medical appointment. So for us, it's been great because 7 of the attendees signed up to join our Carers Voice programme, and they've taken part in further focus groups. Good Things Foundation generously gave some of the workshop time to us so that we could co-design some digital social care services. We explored how carers felt about accessing their statutory carers assessment online rather than the current method, which is actually face-to-face or over the phone. And due to the success of using the case studies, we replicated this method in our subsequent focus groups with some of the same carers. The findings have been great, and all their feedback has helped shape our online assessment for carers that will be launching in the autumn. So watch this space. We're really pleased that our carers were involved in this project, and they've been able to contribute and co-design the new leaflet that reassures people about using digital health services. We plan to publicise the Good Things Foundation's guide to our carers in Birmingham and beyond, so that their fears will be reassured and it will help them in their caring role. The leaflet will also be embedded in our digital inclusion offer and signpost carers to the free training available on Learn My Way platform. And obviously, as well as Jo has said, it won't just sit on our website. We will actually use it as a tool to talk through with carers and really encourage them to download the app and use digital health services much more than they are now. So all in all, being involved in this research project has been mutually beneficial, and I'm sure the new leaflet will be an asset to many carers. Thank you for listening, and thank you again to the Good Things Foundation for inviting us to take part in this meaningful work. Thank you.
Thanks, Bernie. It's really positive to hear how it's been useful for you as an organisation. I think Shaf, are you there? I think you're going to kind of give a bit of your perspective as well as from the perspective of being a carer.
Yes. Hello. Hi. Good afternoon. I'm not going to put my video on because I've got a child at home who will likely keep popping in and out. So forgive me for
That's
that.
fine.
I have to say, my 13 years of caring, it was a real honour for an organisation to want to hear how we felt and what our experiences were. So by way of background, I care for my 13-year-old son who's got various physical and learning needs. But I also care for my mother-in-law who's suffering from stomach cancer. And so there's a whole host of really varying caring needs, excuse me. I'm a huge proponent of the digital services simply because it saves me so much time. It does cause stress. I mean, I had a slight stress trying to access this meeting this morning, but you get over it. And I think that's just my mentality, that you find a way to get through it. But what's really benefited me is that I can attend appointments for my son or make GP appointments and have video consultations. But my mother-in-law, who is challenged because of language barriers that she has and also mobility issues, would struggle to get into a car and go to a car park and help her out of the car and attend an appointment. We've been able to have appointments online for her. And even more beneficial, they've been able to dial in an interpreter who can then access that meeting. And so it helps all around. Obviously, she needs somebody to help on her end to access the digital service. And I think that's something that, and looking at the comments from people in the meeting, that will remain a challenge, that somebody of her generation who has her limitations will always have that struggle. And we've tried to teach her, and it's not happened, and we've not progressed. So she'll always need that support, but ultimately having that meeting online has helped us and the family massively. So I'm a massive proponent. Does it work perfectly? No, but nothing will work perfectly. But overall, is it the right direction? 100%. I use, for example, the Livy service to access GP appointments, and I've had consultations online. That's generally worked fantastically well. I think there are certain limitations trying to access the appointment email. You might run out of time and then it's sort of invalid, and that's a little bit frustrating. You just can't get to things quickly enough. And I think they need to appreciate that we're not always on it. But overall, massive, a massive proponent of it, and I'm so massively honoured that we had that platform to share our views and to share our lived-in experiences.
Thank you, Chef. That's really great to hear, and thank you for bringing the kind of positive experiences of when digital health services can be really helpful. I think it's although the focus of our project was on those barriers and trying to address them, what I've presented today probably doesn't cover those stories that we heard that you've shared as well about when it actually can just be really valuable when the support is there and when the timing is right, and notwithstanding that there might be some irritating glitches and things that you have to overcome to get to that point, which is important to acknowledge as well.
Yes.
Thank you very much for sharing that.
Pleasure.
I think I can see that there's been lots of activity in the chat, which is fantastic. I think Katie has been monitoring what's in the chat, and we've got some time for some questions and reflections. We may not be able to get to everything that's in the chat, depending on how many different things there are. But Katie, are there a few points or a few questions that you want to highlight?
Yeah. I have been trying to answer what I can in the chat, but I've got a couple for a few of you. So I thought, first off, Carol, it might be helpful for you to just give a bit of context. There was a few questions about whether we should be pushing for 100% digital access and what we should do about those people that perhaps still need the choice, and how we take advantage of the capacity that might be being freed up by some people self-serving through digital health services. I wonder if you've got a perspective on that, or can give an NHS view of what the aim is behind all of the transformation.
Yeah, absolutely. In short, the answer is no. Digital forward, but not for everybody, and definitely we need to keep all the analog routes open for people, and this is, and the analog should not be. Talking very broadly about analog here, the analog kind of ways of people being able to engage with services should not become a bolt-on to the digital one, but it should be a very balanced offering between what's offered digitally, and that people have always the route to engage in a meaningful way, in a different way than just digital. I hope that helps.
Yeah, thank you for that. There were also lots of questions in the chat about how you put this belief and trust element in the context of all the other digital exclusion barriers, which I have answered to some extent in the chat. I think I wanted to just flag from a Good Things perspective our National Data Bank, our National Device Bank, and the National Digital Inclusion Network, which offers skills support locally, and many members of that network are health service providers as well. So there is an opportunity for us to join together on that. I think there was a question which, Joe, you raised in your slides about how we can ensure consistency of digital health platforms and the kind of changing number of locally changing platforms and changing guidance and changing approaches. Did anything come up in the research, Joe, that would suggest a mechanism that we might be able to do anything about this? Or Carol, have you got any perspectives about what's coming from an NHS perspective in terms of consistency?
Yes, so if I may start with this, actually. So just to add to what I just mentioned about the analog, the other piece of work that is also happening on the digital route is about working with and through the digital inclusive design leads as well, which make all the apps, like for instance the NHS app, more accessible. So it's not just about digital analog, but it's also about making the digital as accessible as possible for, you know, as wide parts of the population as possible. And that means that, you know, we've got different standards within the NHS, like the accessible information standards, for instance, that we use. There's another standard to do with how the information is presented on different websites, and all of that work is also kind of happening in that context in the NHS, because, you know, kind of patient facing, we've got the NHS app, we've got the NHS website, and we've got many other routes of how people engage in a digital way with the NHS.
Yeah, just to follow up, the answer is no, Katie. I don't think we did hear anything about you know, kind of or practical ways to kind of try and ensure some consistency across the plethora of tools that are out there. And we heard that from both, the concern was raised both by the people in with lived experience in the co-design workshops, but also in the consultation sessions that we held with health and care staff and GPs, etc. For staff as well, I think this has been mentioned in the chat as well. Staff can feel bewildered by these apps and these platforms and navigating them. So at the very least, if we can't ensure kind of consistency and only having a small number of types of app available across the system, if at least we can ensure that there's training and support for staff to build their skills and confidence so that they then can help patients to navigate these systems, that must be a first step if we can't kind of immediately wave the magic wand and get you know, a suite of 4 you know, consistent apps and platforms across the health system, which I think is probably not very likely at the moment.
Yeah, there was definitely chat at the NHS Confed conference about looking to drive more consistency through procurement, but we have to wait and see what's in the 10-year plan to see where that will end up. Yeah, so there was a question about the skills of staff. Where can they get support, but also where, I know this came up in the guide, where can people go if they think they've got it wrong? And what sort of discussions were had around that, and what signposting might be available?
Yeah, and I think that's a real challenge, and it is something that we found very difficult with producing this leaflet, partly because the health system is so different across all parts of the country and devolved nations and things. So trying to work out the best place to signpost people to in the leaflet to answer some of their questions, it's been quite a challenge, and we haven't got that completely right. I don't think we've done kind of the best that we feel we can do. I think what we've tried to identify in the leaflet is where people can go to ask their questions. So that might be a GP receptionist, for example, but it might also be within the community sector that there might be some support there. I wonder if I might throw that open to Bernie, if you don't mind. Just if somebody comes to you with a question about the NHS app and where can I get support to manage it, what's your level, or how do you approach that?
We do try and encourage carers to obviously download the app if they're able to, if they have got a smartphone and have the capability of actually doing that. In fact, I was teaching my parents the other day how to do it. I said, look how great it is. I can just request my repeat prescription. So where we can, we are encouraging them, carers, to do that. And we also provide free data SIMs as well, so that they can access free data on their phone if it's compatible. Yeah, so where we can, we're really trying to encourage carers to embrace technology, that you don't have to use it, it's there as an option to enhance their caring role, just to help them. Certainly the NHS app, I think, rather than having to wait on a phone for ages, you can either just book your appointment or request your repeat prescription.
Yeah, Yeah, thank you. And again, thank you for highlighting so the National Data Bank is one of the services provided through the Good Things Foundation's National Digital Inclusion Network. So availability of free mobile SIMs and data vouchers for people to get connected. So I'm aware that we're coming towards the end. Katie, was there anything else that kind of jumped out at you?
I was just going to ask Carol, there's a couple of questions directly to you in the chat. I just wondered if you might be able to answer them via text, given that we're running out of time. That'd be okay.
I'll try to do my best. Yes,
Thank
thank you.
But that's it, Jo. There are lots more, but you know, we're short of time.
Yeah, thank you so much, everybody, for putting your comments and reflections into the chat. I will go back after the session and have a good read through and see what you've said about these things. I might ask Marlo to launch the closing poll, if that's okay. Again, this is just to help us to gauge how much impact we've had through this session, where this has led you to in your knowledge and understanding. So I'll let you complete that. And again, you'll need to scroll down to question number 2. Okay, and whilst the last few people are completing that, just to say a very, very big thank you to Bernie and to Shaf from Forward Carers and to Carol from NHS England, and again to all of the people who've been involved in producing this piece of work and to getting it out there. And I can just see somebody's already said that they printed some copies of the leaflet out. Oh, it's Maria, and planning to give them out at an event on Thursday. So that's really exciting to hear. And please do share any stories or feedback that you have if you're using the leaflet. We'd love to hear from you and love to get your feedback as well to make it better. So thank you very much for joining us today. And hopefully we will be reducing some of those belief and trust barriers to access to digital health services going forwards. Thank you very much.
Everyone.
Marlo, I think you can end the poll now if that's all right. Thank you. Great. Thank you, everybody.